Teenage years, typically defined as the ages between 13 and 19, are a time of rapid emotional, physical, and hormonal development, but not full maturity. During this sensitive stage, engaging in sexual activity can have long-lasting negative effects on a teenager's physical health, mental well-being, emotional stability, and future life prospects. One of the most critical dangers for teenage girls is that their reproductive systems, including the uterus, cervix, ovaries, and hormonal balance, are still developing and not biologically prepared for pregnancy or sexual trauma. If a teenage girl becomes pregnant, her risk of miscarriage, premature birth, high blood pressure, severe anemia, and even maternal death is significantly higher compared to an adult woman. According to the World Health Organization, complications during pregnancy and childbirth are the leading cause of death for girls aged 15 to 19 globally. Their bodies may not be physically capable of labor, often leading to obstructed deliveries, emergency C-sections, or permanent uterine damage. Beyond childbirth risks, having sex during adolescence significantly increases the chances of contracting sexually transmitted infections, such as chlamydia, gonorrhea, HPV, herpes, syphilis. Teenagers often lack proper sexual education and rarely use protection consistently, increasing their vulnerability. Studies show adolescents are among the highest risk groups for STIs due to both biological susceptibility and lack of awareness. For instance, the cervical lining in teenage girls is thinner and more fragile, making it more prone to tears and viral infections. Teenage boys, too, may suffer from hormonal imbalances, increased anxiety, and premature ejaculation later in life due to early exposure. The emotional and psychological consequences of teenage sex are just as serious. Adolescents are still learning how to process feelings like love, rejection, jealousy, and attachment. Experiencing a breakup, betrayal, or emotional manipulation at this stage can cause deep emotional wounds, resulting in low self-esteem, depression, or even suicidal thoughts. Many teenagers who engage in early sexual activity later experience regret, guilt, and a long-term fear of intimacy. Girls may feel used, ashamed, or emotionally violated, especially if they were pressured into sex or lacked emotional readiness. Boys, too, may struggle with identity, confusion about consent, and peer pressure to prove their maturity. Academic performance often declines when teens become involved in sexual relationships, as emotional distractions and anxiety interfere with focus, learning, and future planning. Early sexual activity also affects brain chemistry, particularly dopamine, the brain's pleasure hormone. Neuroscience shows that adolescents exposed to intense emotional or sexual experiences early in life develop a heightened need for stimulation, which can lead to sexual addiction, dependence on pornography, and difficulty forming stable relationships later. When sex becomes about thrill-seeking or escapism, instead of trust and connection, it causes emotional burnout, where teens lose the ability to bond deeply and begin to view intimacy as casual or meaningless. Teen pregnancy often results in severe trauma. Girls may be forced into decisions like secret abortions, early marriages, or face social rejection and family dishonor. The emotional damage can last a lifetime. In cultures where honor and purity are closely tied to female reputation, a sexually active teenage girl may face abuse, abandonment, or even violence. Even if she gives birth, both she and the baby are at higher risk for poverty, poor education, and lifelong emotional neglect. Medical complications such as preeclampsia, gestational diabetes, and postpartum depression are also more common among teenage mothers. For boys, early sexual involvement can result in aggressive behavior, emotional numbness, and poor understanding of respectful relationships. It can also create unrealistic expectations about women and sex, leading to dissatisfaction, infidelity, and shallow emotional engagement in adulthood. Some teenage boys develop toxic attitudes toward intimacy, treating it as a conquest rather than a connection. These behaviors often become deeply rooted and damage future relationships. There are also legal risks. In many countries, sexual activity involving minors is considered statutory rape, even if consensual. If caught or reported, teenagers can face criminal records, school expulsion, and long-term consequences that haunt their future careers and reputations. On the health front, Teenage girls are more likely to develop vaginal infections, cervical inflammation, and pelvic pain due to underdeveloped reproductive tissues. Many of these conditions may not show symptoms early, but can lead to infertility, PCOS, endometriosis, or recurrent miscarriages later in life. Teenage boys may face future problems like erectile dysfunction, anxiety disorders, or low testosterone due to trauma or hormonal instability caused by early sexual activity. This mindset leads them into toxic relationships, abuse, or validation-seeking behavior that slowly destroys self-worth. Sex at this age often fosters a secretive lifestyle, sneaking out, lying to parents, hiding messages, all of which create guilt, anxiety, and psychological exhaustion. The breakdown in trust between parents and teens can lead to further emotional isolation, rebellion, or harmful habits. Early sexual activity also disrupts hormonal balance in girls, leading to irregular periods, mood swings, infections, and damage to the uterus. Unsafe abortions or complications during early pregnancies may result in permanent infertility or internal scarring. Some teens undergo unregulated or dangerous procedures, which may require the removal of the uterus, ending their chances of becoming mothers in the future. For boys, early sex can result in selfishness, lack of empathy, or even abusive tendencies in relationships. Without guidance and maturity, they may view women as objects rather than partners, which creates a cycle of toxic masculinity and failed relationships. Furthermore, engaging in sex too early can make future marital life unstable, lacking in trust, intimacy, and satisfaction. Spiritually and emotionally, early sex often disconnects teens from their values, identity, and family structure. Feelings of guilt and internal conflict can lead to anxiety, insomnia, emotional numbness, or even panic disorders. Ultimately, sex done without emotional readiness, maturity, or understanding of consequences can leave behind a trail of emotional, physical, and psychological damage that takes years to heal, if it ever does. That is why experts from medical, psychological, educational, and spiritual fields strongly advise that sex should be postponed until a person is physically, mentally, and emotionally mature, ideally in a stable, committed relationship. Sex is not just a physical act. It is an emotional and hormonal exchange that can either strengthen you with love and connection or break you with regret, confusion, and trauma if experienced too early. Teenagers don't just need information, they need understanding, support, and protection. Delaying sexual activity isn't weakness or fear, it's wisdom, self-respect, and strength. If you like my videos, then why don't you comment or subscribe?